Now, another important emergency is drowning. Drowning is the third leading cause of injury death worldwide, and in the United States, drowning is the second leading cause of injury death for children ages 1 to 14 years old. Non-fatal drowning injuries can cause severe brain damage, resulting in disabilities and permanent loss of basic functions. When we have sudden cardiac arrest, for example, it can be from heart attack, the CPR, the first step is to do chest compressions, right? Sequence for the victim of drowning is a little different. Cardiac arrest in a drowning victim is caused by a severe lack of oxygen in the body. This is called asphyxial arrest. And of course, the priority is to get oxygen to the brain, heart, and other tissues. Follow this algorithm. First, call for help. Ask someone to activate the emergency response system. Get to the victim as quickly as possible. Move the victim to shallow water or out of the water. Pay attention to your own personal safety during the rescue process. Check for breathing. If there is no breathing, open the airway with all the rules that we learned and give 2 rescue breaths that make the chest rise. Avoid delays in beginning CPR. Use mouth-to-nose ventilation as an alternative to mouth-to-mouth ventilation if needed. There is no written rule that you need to do routine spinal stabilization unless there are signs that the victim may have a head or neck injury. Do not try to clear the airway of aspirated water. Mostly, drowning victims only aspirate a little amount of water, and it is absorbed very quickly from the alveoli. Do not use abdominal thrusts to try to remove water from the airway. We will talk about abdominal thrusts in choking section. Next, check for a pulse after giving 2 effective breaths. If the victim is not breathing normally but has a pulse, provide rescue breathing only. Recheck for a pulse every 2 minutes. If you do not feel a pulse, start CPR. The ratio is 30 to 2 and give 5 cycles about 2 minutes and then activate the emergency response system if not already done. Of course, get AED as soon as it possible and attach it to the victim's bare skin. Follow the AED prompts if no shock is needed, and after any shock delivery, immediately resume CPR, starting with the chest compressions. What to do when during resuscitation the victim is vomiting? The victim may vomit during rescue breaths or chest compressions. If this happens, turn the victim to the side. If you suspect spinal cord injury, roll the victim so that the head, neck, and torso are turned as a unit, so we can protect the spinal cord inside the spine, especially the cervical part. If you see any vomiting pieces visibly, you can use your fingers to remove it, or you can use suction, of course, if you have it. All victims of drowning should be transported by the EMS to the ED for evaluation and monitoring. It doesn't matter we just gave rescue breaths or we did CPR. And I did a short videos about drowning. It is more advanced evaluation and it includes ACLS protocols too. Even if the patient feels better, they stay at the hospital and we'll observe them because we can have later onset complications. So once again, the first and most important action for a drowning victim is to give rescue breaths as soon as possible. This will increase the victim's chance of survival.